And today what I'd like to do is talk to you about a condition that we see diagnosed in the clinic quite often. And that condition is a condition that is referred to as sciatica. Now, sciatica is basically just a term that is used to describe irritation of the sciatic nerve. Classically, sciatica is blamed on some type of disc herniation, where you can't really see it on this model, but you'll see this structure here, where this yellow structure here, these are the nerve roots that are exiting the spine, and the disc herniation, or a bulging disc, or a protruding disc, or degenerative disc disease, whatever you want to call it, is encroaching into the nerve root itself, creates some irritation on the nerve, and then that irritation will manifest itself down into the buttocks and down the leg, usually past the level of the knee. Now, in true cases of disc herniation, disc protrusion, where there is actually compression on the disc, what we're going to see is not only just pain symptoms down the disc, but down the leg and along the course of the sciatic nerve, but we're also going to see some other corroborating factors that are going to lead us to believe that the problem is associated with a disc protrusion or something going on centrally here. And generally those will be changes in muscle strength, so you'll start to see weakness that'll start to develop, and changes in your reflexes perhaps. All of those will be reflective of something going on more centrally. Like I said, the disc itself, perhaps even some stenosis changes here centrally, can create the condition that we refer to as sciatica. But sciatica can also be the result of something outside the spine. And a classic area, and we discussed this in a previous video, a classic area of sciatic irritation is irritation of this muscle here called the piriformis. And you can see that the sciatic nerve is diving just under the just under the piriformis muscle here. This is the sciatic nerve here, this yellow structure. Sometimes the sciatic nerve will go over the top of the muscle, and in rare cases will go through the muscle. Also, you can get sciatica symptoms as a result of some type of entrapment as it goes down the back of the thigh, and as it rounds the back part or the outside part of the knee. You can get irritation of the sciatic nerve that way that will manifest itself up and down. So once again, sciatica is just strictly a term that is used to describe irritation. The key to treating sciatica is to, number one, identify where the problem is coming from. That's the most critical way of treating it, and the most important way. And then secondly, once you've identified where the problem is implementing the correct treatment program that is usually a very specific sequenced program that you will need to implement in order to treat sciatica. Very rarely is sciatica ever a surgical problem, and like I said, can be treated conservatively quite effectively. I hope that helps you with your understanding of what sciatica is and how you might be able to use this information to basically treat yourself and to understand your particular condition better. If you'd like some more information about how my program might be able to help your particular situation, what I'd like you to do is just to click the link you see right below this video, and I'll be happy to assist you with solving your particular problem. This is Mountain Schexnayder wishing you all good health, and I do hope our paths cross soon.